Really excited. Thank you so much for coming. I know amidst a whole lot of turmoil for you as well, so thanks, Candace.
Good morning, everyone.
Good morning.
Thank you, for this opportunity. My disclaimer, I am not an expert on theory of change. We have been on a journey as an organization over the past year, and what really spearheaded us in this direction was James's In Context session last year, the Durban event, as well as just internally knowing we needed to have an overhaul and revamp our M&E activities, so our monitoring and evaluation activities. I think as we've said, the funding terrain is changing. Even for us with HIV/AIDS, I say it's the same epidemic, but how it translates in community has changed. So we need to be very responsive to what are the current needs in community. And likewise with funding pools are shrinking. So you need to be very strategic in and diversify how you are looking for funds, who are you engaging with, and your data is your gold. That is the information you are gathering, how that's being done, how it's reported, with what transparency and integrity, that speaks to who you are as an organization. So just a bit about us, the Hillcrest AIDS Center Trust. This is our 30th anniversary here. So we were started in 1990 by the Hillcrest Methodist Church. And over 30 years, we've really approached HIV/AIDS with a holistic approach. So we've added different elements, different programs in to address HIV for individuals, for communities, for households from a more holistic approach. So for example, we have an inpatient unit, a 24-bed inpatient unit for late-stage AIDS and cancer patients. We work with primary schools through a soccer program. We do peer education within high schools. We have a lot of economic empowerment activities through our Rosa Moya project. We have a nursery. We have, we have our counseling. We have our drop-in center. So we've added different elements in. Grandmothers we identified as being primary caregivers for orphan and vulnerable children. So we have an extensive network of about 2,000 GOGOs that meet through support groups. They've now developed economic activities within their own groups. We have our annual GOGO Olympics every year, which sadly is next month, which we've had to cancel. It was the 10-year anniversary, where we have 800 GOGOs come together to play soccer and netball, and it's just, it's a fantastic event. But these are all different ways of addressing HIV care, prevention, awareness, support groups, and really to reduce vulnerability for those that are HIV negative, but also helping those who are HIV positive live as healthy and positively as possible. So the complexity of all of that, and to measure all of that, is where our challenge was. Because to measure patients in an inpatient unit, when they're admitted, when they're discharged, their vital statistics, their demographics, is very different than measuring a grandmother support group program or children coming to a soccer program after school. Those are very different measurements and very different approaches to HIV/AIDS. So our mission is unconditional love and hope to anyone impacted by HIV/AIDS. Our vision is an AIDS-free future. So when we took a step back, and this concept of theory of change came about, we were attending a We Are Durban conference focusing on theory of change. And I took all of our program managers and coordinators together intentionally. We took up a couple tables and said, okay, we're going to thrash this out. What is our goal? What is the long-term solution that we want to see within our organization? Because that's why we exist. We want to see some element of social change. And that's different for each of us. But can you define what is your long-term social change that you want to see? Because your organization obviously has a passion for something. Something is broken in society and you want to fix it. That is your goal. And you need funds to make that happen. So how are you able to communicate the value that you're proposing that you can bring to your community to a funder? You need the resources to make that happen, but what is your arsenal? What is in your toolbox to say, we can do this, this is how we're going to do it, and this is how we can prove that we have done what we've said we can do. So as you approach different funders, there are the Sustainable Development Goals, there are national goals, there are CSI goals if you're approaching corporates. Government has their own targets that they need to reach. So when you're approaching a funder, you need to know where they're coming from and meet in the middle to say, this is the change we can bring, and this is in line with what you want to see happen. As I've said, the funding terrain has shifted drastically. So we also, as nonprofits, need to think out of the box. Whether that be working with government, whether it be grants and proposals, which is traditionally how we've gotten our funding. Is it working through social media to promote what you're doing? Leveraging on corporates needing BBBEE points, which is to their benefit to help nonprofits. So there's a lot of tools that nonprofits need to explore to be sustainable. Because without that funding, you can't function. So sustainability is a huge element all of us need to take very, very seriously, and a program that can show you what your impact is, what your measurements are, helps you, gives you integrity and responsibility within your organization, but also adds to your sustainability as you can then demonstrate the impact that you're having. So for example, if you want healthier children, that's what you're aiming for. There's so many different ways you can do that, whether it be nutrition, whether it be connection with caregivers, but what is it that you're measuring? So briefly, what we did, what was our process? So we took a step back and said, what are our strategic objectives? What are our key activities? So we, as I said, with all of these different projects running, we narrowed down our strategic objectives to 4. Health promotion, skills development, income generation, and social empowerment. Now, because we have different programs, for example, income generation, the Go-Go's are doing it one way, our beaters are doing it a different way, our nursery and coffee shop are doing it a different way. So some theory of change processes are very linear. That didn't work for us. So we went for a more circular approach because there was a lot of overlap. Our programs were generating income for our beneficiaries, but through different ways. So, for example, if I can just walk you through one program, because we ended up with 39 key activities. So trying to map 39 different key activities in a theory of change process was a challenge. But for example, taking our soccer program at primary schools, the strategic outcome is health promotion. Our key activity is grassroots soccer. That's provided through our education program. What is your output and your indicator? It's the number of individuals attending a session. That's broken down into boys and girls. It's then and we verify that through attendance registers. So a system like James, I'm not touching on the financial aspect of donor relations, but being able to pull attendance registers, how many boys and girls, What were their pre and post survey results? We can then report that to donors in very tangible statistics. We have measured a change of behavior. Before they started, this is what they thought about different elements of behavior in HIV. At the end of our intervention, this is what they thought. And it's now tracked. So we have numbers and actual data to show to our funder, you entrusted us with this fund, this is what we've been able to do, entrust with us again. Or going to a new funder to say, this is what we've done in the past, trust us to do it again. Yes, and you told me to stop. So really, what I'm just saying is to go back and realize your model is just as important as the intentional thinking through the process. Defining what exactly it is you're doing, how you're doing it, and how are you measuring it. Because that is what funders want to see. That adds to your integrity and your accountability to funders, which then opens new doors because they see you as a trustworthy partner. So monitoring, evaluation, reporting, and then learning. And I think that's what we have systematically, it's a process we're working through. We're not there yet. I think with all of our projects, I think we've uploaded 4, and we're still to do the more complex ones. And that is itself is a ongoing challenge, but this is a living document, your theory of change. It's a living process as you tweak it, as you find out what works, what doesn't work. But the value of it is having the details and the proof that you're measuring what you're doing. So may you find inspiration in the big picture, and may you find your love and passion in the details, which you measure. Thank you.
That was awesome. Thanks so much. Fantastic. Thanks, Candace. So now you're going to discuss together how important are numbers. How important are numbers to our organizations? Okay.